Thank you, John and colleagues, for an excellent panel. Um, I'm Rafael Obregon, and I'm a member of the forum, and also currently I am the representative for UNICEF in Paraguay, and formerly was the lead for UNICEF's global team responsible for risk communication and community engagement. Thank you everyone for staying with us and for joining today's sessions. I think that before we move into the next panel, I'd like to make just a couple of brief points. The first one is that as we look at the presentations that have been made over the last couple of days and today, I think it's clear that issues of vaccine hesitancy and vaccine confidence are part of a larger ecosystem where we deal with issues of policy, systems, services, but also, and perhaps even more importantly, how we deal and engage communities, parents, individuals is extremely important. And in order to build trust, confidence, and engagement with those key social actors, it's really important to see how we actually address one of the issues raised in the previous session, which is the how. While we have a good sense of interventions that may actually work, how we apply those interventions in specific contexts is also key. Building trust, engagement, and confidence is very context specific. And I think that's what this next panel will take us into. The colleagues that we have invited to this panel will share with us very practical examples of how this is done, what lessons have been learned, and what kinds of models they have actually used to actually address these challenging issues. So the overall focus of this session is how community-based approaches and strategies can effectively and ethically be employed to reduce vaccine hesitancy and increase vaccine confidence. And as I said, the terrific panel we put together will go deeper into these issues. As with previous sessions, we will not go into detailed introductions. You all have access to the full bios of the presenters. Similarly, as we go through the presentations, you're more than welcome to share your questions in the Q&A box, and we will try to take as many questions as possible towards the end of the session.